Well, here we are with Dr. Preece, a dentist in Anchorage, in Alaska, the place where they can see Russia from. So, Dr. Preece, let's get to the point here. Let's talk about dentistry and let's talk about missing teeth. Dr. Preece, there's lots of people who have missing teeth. Usually in the back, because in the front they run to a dentist rather fast, but they have a couple, 2, 3 missing teeth in the back, maybe more, and frankly they're missing for a long time, like years. And it seems like nothing really bad is happening, and yet every dentist like you keeps telling us that those teeth gotta be replaced very fast. So can you shed some light on it? What's the real deal here? Nothing really bad is happening, apparently, based on our experience after a few years, and yet you dentists put a lot of importance on replacing them. What's going on?
Well, you know, when a tooth is taken out of the mouth, several things begin to happen. The bone that holds the tooth in the mouth starts to shrink away, and sometimes the teeth adjacent to the missing one will start to drift and tilt and move around. This can affect the bite a bit, so that eventually the person's bite can be so messed up that it can cause headaches, it can cause clicking in their jaw joints. Sometimes as the teeth behind the missing one move forward and drift and tilt, they can develop gum disease around them. And the other thing that happens with missing teeth is that the teeth support the facial structures, the cheeks and the lips, so people start to get a sunken-in appearance on their face. It's such a slow process. It's a lot like maybe trying to watch a nail rust. You know, when did it actually happen? And teeth don't drift quickly. Sometimes it takes many years, so that's why we get complacent and don't think that anything real bad is happening. But if you took an x-ray 10 years after somebody lost a tooth, you'd see that things have changed drastically from when they initially lost that tooth.
I see. So basically what you're saying here is that, number one, you know, the teeth, once there's a tooth missing or a couple teeth missing, it starts being like, I don't know, like a fence. You know, you have all those fence poles in there, and then one starts missing in there. First it's a nice, beautiful white picket fence, and next thing you know, it's one ugly thing, and of course it's not, it's just don't do the purpose anymore. And once a pole is crooked, obviously it kind of like, it starts moving. So it starts looking like that, and can that affect, let's say, a tooth in the back? Can it go as far as affecting, shifting, and making uneven the teeth in the front, or is it just in the back?
Most of the time, the teeth tend to drift toward the front of the mouth, but it is possible for teeth in the front to drift backwards and open up spaces and gaps between your front teeth if you're missing several back teeth. That happens occasionally.
So even your front teeth start maybe then looking crooked and not so good anymore.
Mm-hmm. Mm-hmm.
And something very important you mentioned, which I have other people heard mentioning, and that is headaches and maybe shoulder pain and neck stiffness kind of type of stuff. Now, you know, frankly, that to me looks more devastating than, let's say, the normal conclusion of you gotta chew, you cannot chew right, and you're not chewing your food good. Because there's some people like me, they don't chew anyway, whether we would have all the teeth or not. I mean, I just go up, you know, and the whole steak is gone. But you're right. I mean, I sit down with my wife, and you know, I'm finishing. I'm starting walking around the house, and she goes, "Honey, don't you want to have dinner with me?" I go, "I just did." She says, "I'm on my first bite. What's going on?" But the point is that, you know, headaches, I mean, that's a big bad thing. So are you saying that there may be some people out there who have headaches and stiff neck pains, and they're trying to change pillow, they're trying to figure out what's wrong with their head, when nothing is wrong with their head? They might have an unaligned, a misaligned mouth, misaligned teeth. Is that possible?
That's very possible. If the teeth don't mesh together properly, then it can cause the muscles that operate the jaw to be in spasm. and as those muscles are in spasm, that can create a lot of pain and refer pain to various other areas, including the head. So some people, if their teeth are malaligned, they tend to clench or grind them. I think they're subconsciously trying to get them to mesh properly, wear them in properly, and the muscle tension can cause a lot of headaches and pain.
Wow. So a dentist, well, I mean, what you're saying is a dentist is literally more than what most people assume a dentist is. You know, yes, it's good to have a beautiful smile and all that stuff, but boy, I mean, getting rid of headaches and tension, that's a great thing. So if somebody is out there having headaches and having, you know, this type of like discomfort around the neck and shoulders, even though he has all the teeth in it, is it possible that his teeth are misaligned, and would it be a good thing for him to visit a dentist just to, maybe get it fixed, or at least eliminate and say, no, it's not your teeth either? Would that be a good, a wise move for
that would be a wise move. Sometimes patients go through thousands of dollars and years of treatment by other specialists chasing that pain, and it really is something very simple that could be fixed fairly inexpensively by a dentist, perhaps some type of an occlusal appliance or splint, or maybe just adjusting the teeth at infused spots so that they mesh together a little bit differently might be all it takes. So that would be a very good idea. At least it would eliminate that option before they spend a lot of money on more invasive procedures, perhaps. The other thing that dentists can help with, and a lot of people aren't aware of, is snoring. And of course, we all know that there's a few of us out there that tend to snore at night, keep our partners awake.
We're going to keep that. We're going to keep that for another little video. We have to go here.
Okay.
We're going to keep that for another section, but remind me of it. So basically, missing teeth can not only can they make your whole mouth look ugly, never mind the digestion problem you might have, but the fact is you might have headaches, and as you actually said, your face may cave in because the bones get lost because there's no tooth in it, and your face may get crooked, and you for purpose don't start looking so beautiful anymore. You may put a few years on your face which you otherwise wouldn't have.
Right, you get more wrinkles and a sunken-in appearance a lot of times.
Unbelievable.
Right.
Unbelievable. So that should be a definitely good reason to keep your mouth good, because after all, why should we want to have to go to a cosmetic surgeon, take Botox and all kinds of things? And we all want to, it doesn't matter, guys, girls, we all want to not look 10 years older.
Right, right.
Good. Well, thanks a lot, Dr. Preece. I'll be back to you with some more questions. Bye-bye.
Okay, thank you.